Hey, I'm Dr. Hannah, and today I'm going to talk about how I've been getting insurance without needing to go through an employer for my type 1 diabetes. So I am a contract work physician, which means I don't have a W-2. I'm not considered an employee of the company. I'm a contractor for the clinic I'm working at. And the reason that's important is because it means that I'm not eligible for health insurance through my employer. When I was younger, I grew up thinking that I needed to have health insurance through a job in order to be able to sustain my life with type 1 diabetes and get my prescriptions and my healthcare needs met. But since the onset of Healthcare.gov, we've seen a big change in what we are eligible for as people with type 1 diabetes. And so over this will be my 4th year buying insurance through Healthcare.gov for myself. And it's something that everyone who does not have an offer of health insurance through their employer is eligible for. There is an enrollment period, which is November to mid-December every year, and that is for people who are planning to set their lives up this way. That's when you would log in, fill out an application, and choose the plan that you would like to be on. Now, if for some reason it's outside of that enrollment period, you are in the middle of the year, you lose your job, or you take a different job, you lose the opportunity to have health insurance through your employer, you can apply to a special time frame for enrollment. It's called special enrollment period. So that's something that is open to people. So if you find out that you're not in that enrollment time when you're trying to transition, there's options out there. I can't speak to exactly what qualifies for that, but I was able to get in on that special enrollment time frame, changing positions, I think twice, just because I lost employer healthcare options. I'd say that the quality of the insurance that I have gotten through Healthcare.gov is exactly the same as the variety of health insurance that I had growing up and that I've also had through employers on my own. I don't think that it is lower quality insurance. Actually, some of the plans are from some of the companies you would recognize, like United Healthcare, Aetna. However, I do think that you have the opportunity to choose from a lot more plans. And so you have a little bit of maybe autonomy in whether or not you'd want a high deductible plan with a lower premium, which is just the payment that you make every month, or if you'd want a plan with a lower deductible or no deductible, that's an option on there for people, with a higher premium, meaning that you would pay a higher monthly amount, like a gym membership. A lot of these insurance words are really complicated, so I'm going to try and simplify them as I go through this. A deductible means the amount of money that you have to pay before your insurance kicks in and starts paying for your prescriptions, for your doctor's visits. Now, some plans with deductibles cover your doctor's appointments, cover your insulin, your other prescriptions prior to needing to meet that deductible. Specifically, not as much insulin, since we kind of have some caps on that now for most insurance companies, but more of the direct medical supplies or prescriptions that we're getting for things like our continuous glucose monitors, our insulin pumps, etc. So those are sometimes the higher copay ones that may not kick in before your deductible. Now, if you decide to go the Healthcare.gov route and you are going into their website, you fill out the application, and then you eventually get to this list of all the plans that you're eligible for, it can feel kind of overwhelming. So you can look at some of the pieces and then figure out how you want to do it. I always recommend calling the company to talk to someone and really get clarity on what it would look like as far as coverage and total costs. You can put your prescriptions in to the application process to help with the search engine, and it can actually help to kind of narrow down what companies will cover your prescriptions on their pharmacy coverage list. Not always fully clear. I definitely recommend double checking, because I got myself last year into an insurance plan that didn't cover my prescriptions before I met my deductible, even though I thought it did when I signed up, because it only covered certain tiers of prescriptions, not some of my diabetes prescriptions. So my continuous glucose monitor wasn't covered until I met my deductible, which created a whole strategy change for the way that I paid for things. So with that, just know there's lots of options. Highly, highly recommend calling. 1 year I did work with a recruiter that was not a part of Healthcare.gov, but a different company who helped me analyze these and did a lot of the legwork, which is basically hours on the phone asking questions about how much things were going to cost. That was really helpful, and that was a free service. So that may be something. I don't have access to those recommendations anymore, but I want you to know that they're out there. I'm sure you can Google and find them or ask around. For Healthcare.gov, I've had a really great overall opinion of my care there. The year that I did pick that insurance plan that had different coverage than I had hoped for, I was able to apply for an appeal in order to change my insurance plan before we got back to that regular enrollment period in November, and I was able to get to that. So they were allowing me to change my plan ahead of time, which was great. It ended up costing me less. However, it took about a month or two to be able to make that switch. So know that when you pick a plan, it's not easy to switch outside of that November to mid-December timeframe. So you are committing for the year, which is not hugely different than how it would be if you were working with an employer and choosing a plan. Previously, I've gone with different levels of plans. I would say the big difference for me when I think about my time as an employee is that the premium, the amount that I pay monthly, is higher than the amount that I would pay monthly if I was working with an employer to get the same amount of coverage on average. I was paying, I think, maybe $300 with my employer per month to cover my health insurance, and then obviously paying for my appointments and my prescriptions on top of that. Now I would say the different plans I've gotten through Healthcare.gov over the last 2 years, and it's 2024 when I'm making this video, were $350 and $450 a month with the prescription cost on top of that. Now the prescription costs were lower because I picked those more expensive plans. They do have options for subsidized healthcare, meaning lower kind of co-pays or premiums for people depending on your income. And they do have options, again, for lower premiums that you can just choose, knowing that you may have a higher deductible, et cetera, different pieces. This year, I've opted for a HSA account plan, which is a medium grade. I think I'm in the 300 range for my premium, my monthly cost of healthcare. However, I am going to be able to put money tax deferred into an account that I can then use for my prescriptions. And so when I did the math on this over the course of a year, it did seem to be more advantageous. And that's going to be completely individualized. What's great about an HSA account that's different than an FSA account, if you're familiar with these at all, is that kind of creates a debit card that you can use for healthcare expenses. So prescriptions, doctor's appointments, and even other things that you might pick up, like alcohol swabs that aren't prescription based. There are other things that are covered. Within an HSA, you don't have to use all of that money that year. So you can save it. It can kind of snowball and roll over and be this tax deductible account that you can then purchase your diabetes care from, which I think is great. It doesn't have to be diabetes either. It could be if you go to the eye doctor, different things like that. With the FSA accounts, I didn't actually see any FSA accounts on Healthcare.gov this year. I may have missed it, but those, from my understanding, don't have that same requirement as far as rolling over. There are some differences there. I used to lump them into the same category and just know that they're not exactly the same. Insurance can be really overwhelming, and I'll be honest, it always has and still is for me, almost to the point where when I get to that November, December enrollment period, I procrastinate a little bit on having to pick my plan for the following year because it feels like there are so many numbers. I don't know exactly how it's going to play out. I don't even fully understand all of it. I think I have enough to make a solid decision for myself, but not all the intricacies of how each plan is applied to different scenarios. And it's just overwhelming. So if you're feeling that way, know that I've spent a lot of time working in hospitals, a lot of time working in clinics, a lot of times in medical school, and still the words and numbers, overwhelming. I don't think that it gets easier. It just takes learning the basics of what you need to know. But with that, I've had a really favorable experience getting my health insurance from healthcare. It's really worked out for me to be able to do what I want to do with my career, things like this. I had my own practice for a year. It's created a lot of positive opportunities for me, and it's different than how I thought it would be growing up, thinking that I had to have an employer that was going to provide a healthcare option for me. Overall, there's a lot of, pros and cons to this. I think we live in a good world that we now have the ability to make that choice. It is expensive. It is. I think that is a part of living in America. A lot of people don't know this, but I actually grew up in Scotland. I lived there for 10 years, almost all of my childhood. Healthcare in Scotland looks very different than in the US. It's different all over the world. That's part of the decisions, kind of pros and cons that we have here. I found that doing the jobs that I wanted to do brought more fulfillment and the income to cover the difference in healthcare. So it works for me. I don't think it's a great fit for everybody, but I think it's worth looking into if you have dreams that you feel are stifled by your ability to get health insurance from an employer. there's a choice. You can look into it. You can see what you qualify for, what prices you're given. Again, it's different based on where you are as far as income bracket, but it was an awesome thing for me. Now, if you're under 26 and you have the ability to stay on your parents' health insurance plan, I have seen that to be favorable for most of the people that I've talked to, meaning that leaving your parents' insurance plan, if you have that opportunity, going to Healthcare.gov might not be in your best bet. If you can stay on your family plan until you're 26, that's what I did, and I would recommend that. If you're a student, a lot of times universities will have student health plans. That's typically, in my experience, was a much better option as well than Healthcare.gov. So just know that. And then know that some companies offer health insurance at full-time, and some companies offer health insurance at full-time and part-time. And so that is happening out there. Some people haven't heard of that. And so really asking questions. If you are looking for a new job, you may not have to be full-time to qualify. That's something that I've seen, at least in my experience, change more and more over the last couple of years. And that has a lot to do with the way that smaller businesses or employers can purchase insurance and how that system all works. So I hope this was helpful. Again, this is a hard topic for me, and I almost don't like talking about it because I don't feel like I'm an expert. So all of what I'm saying is very patient perspective, but I think it's a great option. I feel good about the care that I've gotten there. It has been more expensive, certainly, than I wanted it to be, but I feel that it has taken care of me well and allowed me to pursue my dreams. If you haven't already, like and subscribe if you like this kind of stuff and these types of conversations to my channel. It would be wonderful. The more I'm able to get interactions, the more I'm able to continue making videos like this. So thanks so much for sticking to the end, and I look forward to seeing you next time.